Heat stroke is the most severe form of heat-related illness. It's basically what happens when your body overheats to a dangerous level and can't cool itself down. Normally, your body regulates its temperature by sweating, which cools the skin as the sweat evaporates. However, when it's extremely hot or when humidity levels are high, sweating becomes less effective and the body struggles to cool itself. Think of your body like a car engine. When a car overheats, it can cause serious damage. The same thing happens with your body during heat stroke. Your core temperature rises to 104 degrees Fahrenheit or 40 degrees Celsius or higher, and this can start to affect your brain and other organs. It's not just uncomfortable, it's a medical emergency that can be life-threatening if not treated quickly. Heat stroke isn't just about feeling hot and sweaty. It can cause confusion, loss of consciousness, and even damage to your brain, heart, kidneys, and muscles. One important thing to understand is that heat stroke is different from heat exhaustion, which is a milder form of heat-related illness. Heat exhaustion can lead to heat stroke if it's not addressed, but heat stroke is much more serious and requires immediate medical attention. In fact, according to some estimates, heat stroke is one of the leading causes of death among young athletes in the US. Types of heat stroke. There are two main types of heat stroke: exertional heat stroke and non-exertional or classic heat stroke. Both types result in the body's inability to regulate temperature, but they arise from different causes. Number 1. Exertional heat stroke. This type is more common in younger, active people. It happens when you're doing intense physical activity in hot weather. Think of athletes training in the summer, soldiers doing drills in heavy gear, or construction workers on a scorching day. It can come on suddenly, sometimes in just a few hours. Number 2. Classic heat stroke. This type typically affects older adults, young children, or people with chronic illnesses. It usually happens during heat waves, especially if you don't have air conditioning. It can develop slowly over several days of exposure to high temperatures. Elderly people living alone in unair-conditioned apartments during a heat wave are particularly at risk for this type. Both types are dangerous, but exertional heat stroke can be particularly tricky because it can affect young, healthy people who might not realize they're at risk. Causes of heat stroke. At its core, heat stroke happens when your body absorbs or produces more heat than it can get rid of. But there are several causes that can lead to this situation. Number 1. High temperatures. This is the most obvious cause. When it's really hot outside, especially if it's humid too, your body has to work harder to cool itself down. If the air around you is hotter than your body temperature, you can't effectively release heat into the environment. Number 2. Dehydration. Your body needs water to produce sweat, which is its main cooling mechanism. If you're not drinking enough fluids, especially in hot weather, you're making it harder for your body to cool itself. Number 3. Clothing. Wearing too much clothing or clothes that don't breathe well can trap heat and prevent sweat from evaporating. Number 4. Age. Very young children, particularly under the age of 4, and older adults are at higher risk because their bodies don't adjust to temperature changes as well. Number 5. Intense physical activity. When you exercise or work hard, your body generates heat. If you're doing this in hot weather, you're increasing the heat your body has to deal with. Number 6. Certain medications. Some drugs can affect your body's ability to stay hydrated and regulate temperature. These include diuretics, some blood pressure medications, and certain psychiatric drugs. Number 7. Chronic illnesses. Conditions like heart disease, obesity, and diabetes can make you more susceptible to heat stroke. Number 8. Lack of acclimatization. If you're not used to hot weather, like if you've just moved from a cooler climate, your body hasn't had time to adjust to dealing with the heat. Symptoms of heat stroke. When it comes to heat stroke, recognizing the symptoms early can be a real lifesaver. The most obvious sign is a high body temperature. We're talking about 104 degrees Fahrenheit or 40 degrees Celsius or higher. This will manifest as extremely hot and dry skin. Unlike heat exhaustion, where profuse sweating is common, people with heat stroke may stop sweating altogether. Their skin may feel hot and dry to the touch, as the body is no longer able to release heat through sweat. In some cases, the skin may appear red or flushed. Rapid breathing and an increased heart rate are common as the body tries to cool down and compensate for the extreme heat. You may feel your heart racing, and your breathing may become shallow and fast. These signs indicate that your body is under significant stress, trying to keep vital organs functioning despite the rising temperature. Other symptoms include nausea and vomiting, as the body becomes overwhelmed by the heat. You may feel an intense sense of fatigue or exhaustion, and in severe cases, muscle weakness or cramps. Headaches are also common, often throbbing or severe, as the brain struggles to cope with the heat stress. As heat stroke progresses, the brain may struggle to maintain consciousness, leading to confusion, slurred speech, or loss of coordination. If untreated, the condition can quickly escalate, leading to unconsciousness and organ failure. Diagnosis of heat stroke. When someone is suspected of having heat stroke, medical professionals will immediately check their body temperature using a rectal thermometer, as this is the most accurate way to gauge core temperature in heat-related emergencies. A core temperature of 104 degrees Fahrenheit, 40 degrees Celsius, or higher is the primary diagnostic indicator of heat stroke. In addition to temperature, doctors will assess other symptoms, such as confusion, lack of sweating, and skin appearance, to confirm the diagnosis. Blood tests may be performed to check for signs of organ damage, such as liver or kidney dysfunction, and to monitor electrolyte levels, which can be disrupted by severe heat exposure and dehydration. Doctors may also order urinalysis to check kidney function, as the kidneys are particularly vulnerable during heat stroke. This can also help assess your level of dehydration and check for muscle damage. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Treatment for heat stroke. The treatment for heat stroke is focused on quickly lowering the body's core temperature to prevent organ damage and other complications. The faster a person's temperature is brought under control, the better their chances of recovery. First of all, you need to get out of the sun and into an air-conditioned building if possible. If AC isn't available, find a shady spot or anywhere cooler than where you were. Also, you should remove excess clothing. The less clothing, the easier it is for the body to cool down. One of the most effective ways to reduce body temperature is immersion in cold water. If available, immersing the person in a tub of cold water or an ice bath can rapidly bring down the body's core temperature. This is especially useful in cases of exertional heat stroke, where the body temperature can rise extremely quickly. However, this method is not always available in every setting, so other cooling techniques may be used. If cold water immersion isn't an option, cooling with cold, wet towels or ice packs placed on key areas of the body, such as the neck, armpits, groin, and back, can help lower the temperature. These areas contain large blood vessels close to the skin, and applying cold packs can help cool the blood as it circulates through the body. You can also mist the person with cool water and then fan them. As the water evaporates, it helps cool the skin. Hydration is another crucial aspect of treating heat stroke. Intravenous fluids are typically administered to rehydrate the body and restore electrolyte balance, which is often disrupted during heat stroke. Drinking water or electrolyte solutions is essential, but if a person is unconscious or vomiting, IV fluids are the safest and fastest way to rehydrate. Remember, if you suspect someone has heat stroke, it's crucial to call emergency services immediately. While you're waiting for help to arrive, focus on cooling the person down using the methods we discussed. Now, we want to hear from you. Have you ever experienced heat stroke or any other heat-related illness? What steps did you take to recover, and what advice would you give to others? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.